Here in the center of Gaza City in Al-Wahda Street, workers are still clearing the rubble of a building destroyed in the conflict between Israel and Hamas in May, one of the several continuing crises. A few blocks away, Dr. Shadi Awad and his team have been fighting the coronavirus pandemic at Gaza's largest hospital, Al-Shifa Hospital. This ward is dedicated to testing and treating patients suspected of having a COVID-19 infection. While the number of seriously ill patients has slightly decreased in recent days, infection rates remain high.
We used to categorize these cases in people who could be sent home and treated at home, and cases who were admitted and treated in hospital. Some were sent to intensive care. We've been in this latest wave of the pandemic for a month. It's been the biggest and most intense wave since the beginning of the pandemic here in Gaza.
The staff are exhausted, the doctor says. Over 1,500 people have died of COVID-19 in Gaza. The pandemic has further strained an already weak health system and dire economy. The small territory ruled by the militant group Hamas has been effectively cut off by Israel and Egypt for the past decade. Although scarce in the beginning, vaccines have become increasingly available, but more people need to take them.
Still, we will work with the community in engagement with the community and help the authorities here to spread the facts and the safety of the vaccine and to encourage people to get the vaccine. At the moment, Gaza has reached 40% of vaccination among the targeted population.
Roughly 1.2 million out of Gaza's 2 million inhabitants are eligible to get a jab at a vaccination center like this one. Authorities have made vaccinations mandatory for certain categories of people, such as those working with the public. However, reactions are mixed.
In Gaza, there are a lot of problems. It's very crowded. There is a lot of mixing in the workplace, in schools, among students, even with the elderly. Our society is very closely linked, so vaccination is very important. I took the first and second dose of the Sputnik vaccine, and now they've sent us the third dose.
Here, people are generally not that concerned about taking precautionary measures. They don't care about corona that much anymore. I feel that people are just going along with things, so COVID is not affecting them like it did before. Maybe the most important thing is the economic situation.
While the pandemic continues to weigh on daily life, it is just one of the several ongoing crises people have to deal with in Gaza.